Hi everyone, welcome to this powerful presentation on diabetes. My name is Bwiri Nyansongo. Ladies and gentlemen of excellence, today's agenda is very simple. Help answer your questions about diabetes, explain different types of diabetes, explain high blood sugar levels, and also help outline how you can manage your diabetes. To begin with, what is diabetes? Diabetes is a chronic condition where the body either doesn't produce enough insulin or can't use it effectively. This leads to high blood sugar levels. There are two main types of diabetes, type 1 and type 2 diabetes. You may be wondering, what are the signs and symptoms of diabetes? You may be diagnosed with diabetes after you go to your doctor because increased thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, blurred vision, slow healing sores, frequent infections, tingling or numbness in hands, stroke feet, and of course, dry skin. What are the different types of diabetes? We have type 1 diabetes, which is autoimmune, often diagnosed in youth. We have type 2 diabetes, which is linked to lifestyle and genetics, more common in adults. We also have got gestational diabetes, which develops during pregnancy, usually in the second or third trimester, caused by hormonal changes, and of course, affecting insulin use, causing high blood sugar levels. You could perhaps be asking yourself, what are these high blood sugar levels? High blood sugar levels or hyperglycemia occur when there's too much glucose in the blood due to insufficient insulin or insulin resistance. Another critical question is, what causes high blood sugar levels? High blood sugar levels are caused when the body doesn't produce enough insulin or can't use it effectively. Insulin is the hormone that helps move glucose from the blood into cells for energy. Without enough insulin, glucose builds up in the bloodstream. Now, what should be your ideal blood sugar level? A fasting blood sugar level should be between 3.9 to 5.5 millimole per liter. 1 to 2 hours after eating, it should be less than 7.8 millimole per liter. HbA1c should be less than 5.7%. For people with diabetes, fasting blood sugar level should be between 4.4 to 7.2 millimole per liter. 1 to 2 hours after eating, it should be less than 10.0 millimole per liter. For HbA1c, it should be less than 7%. When should you do your blood tests? For fasting, it's done after 8 hours without eating. For random, anytime, regardless of meals. For OGTT, that is oral glucose tolerance test, it's done before and after drinking a sugary solution. For HbA1c test, it's done every 2 to 3 months to check average blood sugar levels over time. If, for instance, you are diagnosed with diabetes, what type of diet should you eat? Well, first and foremost, you should consider eating a balanced diet, which is rich in whole grains, vegetables, lean proteins. Lean proteins include poultry, red meat, name them, and also health fats. Limit sugary foods, refined carbs, and processed items, and also control portion sizes to help keep your blood sugar stable. Do you people normally consider doing some sports and exercise? If not, then be aware that sports and exercise help manage diabetes by lowering blood sugar levels. They improve insulin sensitivity and also aid weight control. Regular physical activity also boosts overall health and also reduces the risk of complications. If you happen to be diabetic, what type of medication will you need? Good. The medication for diabetes may include oral drugs like DPP-4 inhibitors such as alogliptin, alpha-glucosidase inhibitors like acarbose. Others include metformin, which in most cases is the first line of treatment. We also have insulin injection if the body doesn't produce enough insulin. The choice, however, depends on the diabetes type and individual needs. Now that marks the end of my presentation, and I just want to take this opportunity to thank you, ladies and gentlemen of excellence, for paying attention and watching my presentation. I highly welcome you for any questions, comments, or suggestions. Thank you, and I'm very grateful for you people.